Adverse Childhood Experiences, ACEs, presented by the Healthy St. Mary's Partnership Violence, Injury, and Trauma Action Team in partnership with the Patuxent River Fleet and Family Services and St. Mary's County Health Department's Violence, Injury, and Trauma Unit. This presentation discusses adverse childhood experiences, or ACEs, their impact on health and well-being, and the importance of prevention and intervention strategies. Understanding adverse childhood experiences. ACEs are traumatic events in childhood that can lead to long-term negative effects on health and well-being. ACEs include physical, emotional, or sexual abuse, parental divorce, and incarceration of a guardian. Originated back from the CDC and Kaiser Permanente's ACE study, which has led to over 70 research papers since 1998. ACEs can harm brain development and lead to chronic diseases, depression, and mental illness. As the ACE study has shown, child abuse and neglect is the single most preventable cause of mental illness, the single most common cause of drug and alcohol abuse, and a significant contributor to leading causes of death, such as diabetes, heart disease, cancer, stroke, and suicide. Bessel A. van der Kolk, The Healing of Trauma. Accumulation of ACEs and their lifelong effects. The impact of ACEs can accumulate over time, affecting individuals throughout their lives. Children who repeatedly and chronically experience adversity can suffer from toxic stress. Toxic stress happens when the brain endures repeated stress or danger, then releases flight or fight hormones, like cortisol. This internal alarm system increases heart rate and blood pressure and damages the digestive and immune systems. Toxic stress can disrupt organ, tissue, and brain development. Over time, this can limit a person's ability to process information, make decisions, interact with others, and regulate emotions. These consequences may follow a person into adulthood. Demographics and prevalence of ACEs. Certain groups are more likely to experience ACEs, highlighting disparities in exposure. There are higher ACEs reported among non-Hispanic Americans, individuals with less education, and those earning under $15,000 annually. Increased prevalence amongst the LGBTQ+ individuals, the unemployed, and multiracial or Alaska Native people. Nearly 2/3, or 64% of adults, have at least one ACE, with an 87% chance of having two or more. Generational trauma and its impact. Generational trauma can perpetuate the cycle of ACEs across families and communities. ACEs can occur in various environments, including households and communities, leading to toxic stress. Unaddressed toxic stress can harm individuals and communities, reducing resilience to future stressors. Families that have experienced historical and systemic racism or are living in poverty for generations can lead to increased risk for ACEs. Evaluating ACEs. The ACE questionnaire. The ACE questionnaire measures 10 specific adverse experiences to evaluate childhood trauma. So what's evaluated? The 10 ACEs the researchers measured were the physical, sexual, and verbal abuse, physical and emotional neglect, a family member who is depressed or diagnosed with other mental illness, addicted to alcohol or another substance, or in prison, witnessing a mother being abused, losing a parent to separation, divorce, or other reason. ACEs is a measuring tool to evaluate, as a guideline, the behavioral risk factors that begin before the age of 18. The role of resilience in mitigating ACEs. Resilience can help mitigate the negative impact of ACEs on individuals. Adverse childhood and community experiences can occur in the household, the community, or in the environment and cause toxic stress. Left unaddressed, toxic stress from ACEs harms children and families, organizations, systems, and communities, and reduces the ability of individuals and entities to respond to stressful events with resiliency. Research has shown that there are many ways to reduce and heal from toxic stress and build healthy, caring communities. ACEs in the military. Higher prevalence of ACEs amongst service members. Many military personnel report higher than average ACE scores compared to the general population. Common ACEs reported include household substance misuse, domestic violence, mental illness in the home, and parental separation. Military stressors can compound existing trauma. Coping strategies include emotional regulation, stress management, and relationship stability. Local services. Family support services, such as the Pax River Fleet and Family Services, community-based mental health services, peer support programs, and parenting support programs. Interventions and prevention strategies for ACEs. Effective interventions can help prevent ACEs and support affected individuals. Key practices include trauma-informed care, community resource referrals, and personalized treatment for chronic illness. Interventions and prevention strategies for ACEs. Effective interventions can help prevent ACEs and support affected individuals. Key practices include trauma-informed care, community resource referrals, and personalized treatment for chronic illness. Prevention strategies focus on recognizing risk factors, parenting programs, and addressing social determinants of health. Creating positive childhood experiences. Positive experiences can counteract the effects of ACEs and promote healthy development. Importance of trauma-informed care. Trauma-informed care is crucial for supporting individuals affected by ACEs. It emphasizes safety, trustworthiness, and collaboration in treatment settings. Understanding the unique experiences of trauma survivors is essential for effective support and healing. We can create positive childhood experiences by strengthening families' financial stability, promoting social norms that protect against violence, help kids have a good start, teach healthy relationship skills, connect youth with activities and caring adults, intervene to lessen immediate and long-term harms. Resiliency over adversity. Small, consistent acts of self-kindness and self-care help undo some of the stress patterns shaped by early traumatic experiences, such as ACEs. Taking care of yourself, self-care checklist. Physical fitness, nutrition and hydration, sleep and rest, assertiveness skills, centering and solitude, creative activities, fun and enjoyment, support provided, support received, set and monitored goals, meditation, yoga, and Pilates. What else? These are all positive self-care activities you can engage in to mitigate stresses from ACEs experiences. Be gentle with yourself. Healing from ACEs is a journey, not a race. Resources for addressing ACEs. Various resources are available to help individuals and families affected by ACEs. The CDC provides information on ACEs and violence prevention. Seeking professional help from trauma-informed psychologists is recommended for survivors and parents. For more information, please visit smchd.org or healthystmarys.com and click on the Violence, Injury, and Trauma selections for more information on this presentation and the Adult Adverse Childhood Experiences.